All right, so welcome to our webinar for Tuesday, June 30th, the day before Canada Day. So let me see, what are we up to today? As always, this is going to be a walk and talk session with me. My name is Rob. I'm one of the cardiac rehab supervisors here at the program, and I will be taking you through about a 25 or 30-minute session with a combination of some aerobic training, a little bit of stretching, excuse me, and then some resistance training at the ends. That is our plan for today. Just a couple of points to get out of the way before we start. This program is pretty simple and straightforward. It should be doable by pretty much anyone, but it's ideally supposed to be done by people who are already participating in an exercise program or a rehab program. If you haven't started any rehab, just make sure you get some clearance from your doctor before you jump in. I'm a big fan of telling people that we should be looking to exercise 5 days per week. This is one session on Tuesday. I host another one on Thursday, so that is 2. So hopefully you're getting at least 3 more sessions throughout the week. If you do like to follow along with these videos, you can do that because we do record them and they're stored online. You go to cardiaccollege.ca, you can see all of them there. As I said, this is a fairly low-level exercise program, so you shouldn't be feeling any discomfort at all. But you might feel a little bit of fatigue in your legs because most of what we're going to be doing is marching. You might feel your breathing goes up a little bit, but no other symptoms should be felt. If you do have any symptoms, pain or problem or anything like that that develops during the exercise session, please stop doing the exercise. Hopefully the pain goes away. If it does not, then make sure you call 911. Okay. So for today, hopefully you've had a good week and you're feeling well with no problems, taking advantage of that lovely weather we've been having of late. No symptoms at all, chest pain, shortness of breath, dizziness, lightheadedness, palpitations, none of that. You've taken all of your medications today. And for those of you who are living with diabetes, hopefully your blood sugar is at a safe level. All right, so let's get that out of the way. There we go. You can see my big smiling face. And let's get going with our exercise. All right, so to start off, everyone, we always like to get our resting heart rate. So if you can find your pulse at your wrist or here in your neck, please do so. And we do a 10-second pulse check, and I'll give you that count in 3, 2, 1, go. And stop. Right, so hopefully you've gotten into the habit of checking your resting heart rate before you do any kind of exercise or exertion. That number can vary a fair bit, you know, around 10 beats in 10 seconds at the low end, up to like 16 or so at the high end. A lot of our cardiac patients are on medications like beta blockers, which slow the heart rate down. So it's not unusual for some of our patients to get resting heart rates of 9 or 8 or maybe even 7 in 10 seconds. Okay, so before we do our exercise, we always like to do our dynamic warm-up to get ready for the exercise. So let's start off with getting the legs warmed up, and let's just do a little bit of marching in the spot. Bringing their knees up, just warming up those leg muscles, getting the knees, the hips, the ankles loosened and limbered up. We do this for about 20 seconds or so. All right, so let's loosen up our hips. So please hold on to something that's fairly solid for a little bit of support and balance. And we're going to do our hip swings. So standing up nice and straight and tall, looking forwards, and then just doing some nice, slow, deliberate swings with our legs. Nothing too aggressive, nothing too vigorous, just to loosen the hip up a little bit. All right, let's put your feet on the ground. Let's slowly turn around, face the other direction, and now we'll do the same with the other leg. Nice and slow and deliberate. Okay, both feet on the ground. Let's do our ankle rotations. So I always like to lean against something. Here in our kitchen and rehab, I'll lean up against the stove. And then I'm going to do some nice big circles with my toe. Loosen up those ankles. If you're like me, you hear a lot of cracking, snapping, and popping. All those tendons and ligaments sliding around. Make sure you get both directions. Often people wondering if all that cracking and popping noise, if it's a bad thing. As long as it doesn't hurt, you're going to be okay. All right, let's switch to the other foot. For me, when my ankles and knees go crack, snap, pop, it just means I need to do more stretching and lazy. Get both directions. Excellent. And then let's finish off with some shoulder circles. Get everything nice and loose and ready for our exercise. And once again, both directions. All right, so that's what we call our dynamic warm-up, our 4 exercises. Now we're going to start doing our aerobic warm-up. So for the aerobic warm-up, we should be looking to do whatever exercise we're about to do, just a little bit slower. Gives our chance to optimize, our body the chance to optimize the blood flow. So we'll constrict some of the blood vessels in your stomach, and we redirect some of that blood to the working muscles. In our case, it's going to be our legs. Likewise, it gives our coronary arteries a chance to dilate. When we dilate our coronary arteries, that brings a lot more oxygen-rich blood to the heart muscle. By bringing more oxygen-rich blood to the heart muscle, you get it ready to work most efficiently. All right, so pumps up nice and strong, decreases the odds of you having any angina if you're prone to getting that, any kind of rhythm problems. Always good to build into exercise. Body's got changes it does to accommodate the exercise. Give your body the time to do that. And of course, when we do our warm-up, we usually say about 4 or 5 minutes is enough to make all these blood flow changes happen. So let me see, questions from last week. Really only there was one question that we didn't address in last week's session, and that was just about footwear. What kind of shoes should you be wearing when you work out? I'm a big fan of asking people to wear running shoes, even if you're just doing a walking program. The reason that we're big fans of running shoes is when you look at a running shoe, I should have taken one with me so I could show you, but everybody knows the heel in a running shoe is nice and big and fat. That heel, that big fat heel, acts as a wonderful shock absorber, because every time we take a step and our heel strikes the ground when we're walking, creates a little bit of a shock wave when we first hit the ground. Now, for most of us, we're walking on really hard surfaces, poured concrete, sidewalks, roads. When that shock is created, when our foot hits the ground doesn't really absorb the shock so well, which means it's going to go upwards. If you've got a good pair of shoes, ideally with a nice big fat heel, that big fat heel will absorb the shock, and that's the end of the problem. If you don't have good shock absorbers in your shoes, the shock's going to go through the shoe into your heel, up into your ankle, up to your knees, your hips, your spine, all the way up to your head. It can cause problems all along that route. So generally speaking, people are more likely to exercise when they feel good. So if you wear running shoes, it can absorb a lot of the shock, so your ankles, your knees, and your hips feel more comfortable when you're exercising. And let's face it, the more comfortable an activity is, the more likely you are to do it. So we typically encourage people to wear running shoes. And because I have no other questions to answer, I'm going to share you a story of my early days in cardiac rehab. So I remember, oh boy, like 24 or 25 years ago, I had a patient who started the program. He was a young guy. Can't remember his name, but it's like 6'4", and I always remember him as the cowboy because he showed up on our intake class in a cowboy hat and cowboy boots. I wasn't sure how compliant a patient he would be, but turned out he actually did really, really well in the program. So back in those days, people would come, and for the first class, they would do what's called an exercise trial. So we'd take them out onto the track, have them do some walking, just to try and figure out the ideal, the optimal pace for them to walk. And I'm just noticing that's 4 minutes of warm-up. So for those of you at home that would like to walk a little bit faster to get more of a heart rate increase, to get more training, now is the time to do it. Just pick up your pace a little bit. If you've got good balance and you're motivated, you can add some upper body work as well. Using your arms, you're using more muscle mass. By using more muscle mass, your heart has to supply more oxygen-rich blood. It's doing more work, and this will give you a little bit more of a training effect. Only if you feel comfortable doing this and if you have good balance. Because I'm talking, I'm not going to use my arms. I'm just going to stick with the walking. So this guy came in for his cardiac rehab, my cowboy patients, and did his exercise in the track. And when he came for his day, as I said, he was wearing cowboy boots. And I thought, oh boy, that's not good. I was a young punk back then, if you will, fresh out of school. And I told him, I said, listen, guy, you can't do a cardiac rehab or walking program in cowboy boots. It doesn't work. So he was a pretty motivated guy. He went out, bought some good running shoes, and came to class next week wearing the running shoes. And I thought, great, this is fantastic. So he starts the first week doing his walking, and comes back the next week, hands in his exercise log. Rob, this is everything I've done. But I'm getting some pain in my legs. You know, it was never a problem before, but now I'm getting this pain with this walking program. And I'm fresh out of school. I know the answers to everything, right? I said, don't worry. It's you just got to stretch your legs a little bit. You're not used to it. So I showed him some stretches, runner stretch in particular that we always do after these sessions. I said, just do the stretching, go home, do the walking, you'll be fine. So he comes back the next week and he says, Rob, my legs, they're still hurting. I said, oh, well, are you doing the stretching? Yeah. I'm doing the stretching regularly, just like you told me. Like, okay, well, that's fine. Well, let's take the treatment up a level. You might have some inflammation in your shins. Let's add some icing to the routine. So keep doing the walking in your running shoes, but do the stretching and put some ice on your legs at the end of the day for about 5-10 minutes. Says, no problem, Rob. Comes back the next week, hands in his exercise log, and he says, Rob, my legs, they're still hurting. It's like almost a month now. I'm not happy with this. I'm like, yeah, okay, I get it. Just, keep doing the stretching, keep doing the icing. It'll go away. So he comes back the next week, gives me his exercise log. He's got a big smile on his face, and he says, Rob, the pain it's gone away. And I'm sitting there thinking, see, I told you so. You just had to listen to me and do what I said. At which point he looked at me and he said, Rob, I went back to wearing my cowboy boots. So of course I'm kind of chuckling at this point. And it taught me an important lesson. If something's not broken, why am I trying to fix it? This guy had come to us at the start of his rehab program. He never had problems with his legs. He had a heart attack, of course, but never had leg problems and everything was fine. So I encouraged him to go out and buy running shoes, which he did, but it changed the way he walked enough that he started developing leg problems with the new footwear. So if someone asks me, Rob, what kind of shoes should I wear? Running shoes tend to be the right answer, with one little caveat. If you can walk all day in a comfortable pair of shoes and you never have leg problems, wear those shoes. Right? That, I think, is probably the right answer, and that's what I learned from this patient. But if you do have sore legs from walking, and you're wearing really old, beat-up shoes, one of the things we're going to suggest is you do get appropriate footwear. But running shoes tend to last for about 6 months or so. And at 6 months, the shoe itself might still look very good, but the shock absorber, the foam in the heel, tends to get a little compacted and dense, and then it doesn't work as well. So typically half a year, maybe a little bit longer if you're not walking as much, or if you're a smaller person and you're a little lighter. Likewise, maybe a little less than 6 months if you're walking a lot or you're a big strapping guy. So just something to keep in mind. So that was our question about footwear. Let me see, what else can we talk about? We can talk about the video sessions for the next little while. So we're going to have another session that I'm doing live. It'll be on Thursday at 1 o'clock. Feel free to send in questions so I'm not just babbling. Next week, I'm on vacation. So next week, we're not going to have any sessions. And as a matter of fact, for the rest of July, I think we're going to suspend these sessions. We're in the process of trying to reopen and let a few people come back into the program. Mostly new patients who have their cardiac events during the COVID times. That's kind of taking a little bit more of our energy and resources to get things up and running. So for July, we're probably going to put things on hold. Of course, do remember that all the sessions that we've done through June are recorded and on our website. So just because I'm not doing this session live with you, you can still bring up one of the old sessions and follow along that way. All right, so I wanted to share that with everybody. Yeah, here we go. Those are my updates. So with the exercise that you're doing at home, I saw a really cool video earlier this morning after I was chatting with one of my patients. There is a doctor. He works downtown here in Toronto. His name is Dr. Mike Evans. And Mike is a great guy. He explains things incredibly well. Fantastic physician. He has a YouTube channel. So if you go to YouTube and you search for Dr. Mike Evans, you'll get his page. And Dr. Evans has got a whole list of videos on a whole ton of different topics where he explains a lot of really complicated things in nice, simple to understand language and in a short period of time. I know for a lot of my patients, I always say, Rob, you explain things so well. Dr. Evans is absolutely in a world apart. He's fantastic. So if you're ever looking for motivation to keep exercising, take a look at his YouTube page. It's got a lot of great stuff. He explains things really, really well. So worth a visit. Go to YouTube and search for Dr. Mike Evans. Big plug in for Mike. The video that I was watching earlier today was all about exercise intensity. I'm going to talk about that when we do our cool down. And we're going to go for, I think, 2 more minutes, then we'll do our cool down. So exercise intensity is basically how hard are you exercising? How hard are you working? When I talk about exercise and fitness in particular, I really talk about 2 different types of fitness. There's one type of fitness that's called metabolic fitness or metabolic conditioning. Metabolic fitness has to do with your blood pressure, your blood sugar, your blood cholesterol, body composition. You can improve your metabolic conditioning by leading an active lifestyle. So just being active, doing an awful lot of stuff throughout the day, burns a lot of calories, and this is a great way to improve your metabolic conditioning. And for risk factors for heart disease, this is an important thing to do. The other type of conditioning that I'll talk about is cardiovascular fitness, cardiorespiratory fitness, CRF is what all the doctors call it. And that's really the strength of your heart is a big core component of that. This is also really, really important as well. To improve your cardiorespiratory fitness, you actually need to start exercising a little bit harder, a little bit more vigorously. You need to go at a pace where your breathing picks up a little bit, or maybe you're sweating a little bit. If you're using your legs, you might feel a little bit of fatigue in your legs. But working a little bit harder, increasing your exercise intensity, that's what's going to make your heart muscle stronger. And that's really important. And a lot of people out there will struggle with the concept of, well, I'm just doing a lot of walking. I walk all day at work. Isn't that good? And it is. It's very, very good for your metabolic fitness, but it's probably not doing as much for your cardiorespiratory fitness as we would like. So it's important to lead an active lifestyle. And if your job lets you do that, that's great. You've also got to put the time aside to exercise at a high enough level where your breathing gets up a little bit more, where you perspire, where you sweat a little bit, because that's going to strengthen your heart, and that's really important, folks. Okay, so let's get our exercising heart rate. So find your pulse at your wrist, right, your neck. Make sure you keep moving, sway left to right like I'm doing, and I'll give you a 10-second pulse check in 3, 2, 1, go. And stop. And we'll do our cool down. Cool down is the same as the warm up, whatever activity you were just doing. Same thing, just slower. And with exercising heart rates, hopefully you're checking it on a regular basis and you're getting a feel for what your usual value is. Some people, their heart rate might only go up 1 or 2 beats in a 10-second count. That's fine. Other people, their heart rate might go up 10 or 15 beats. That's fine too. People at home need to get in the habit of understanding what normally happens for them. All right, because we're all different and our heart rate responses will be different as well. All right, so getting back to the intensity, making sure that you spend the time specifically to improve the strength of your heart and the lungs and the muscles' ability to get oxygen-rich blood. And that's working at a high enough level that your breathing does go up a little bit. You might be sweating a little bit, but it's important, folks. I know it's hard. Nobody likes to get sweating, and it doesn't always feel comfortable, but it's important to do. Should be pain-free though, right? Breathing a little harder is okay. Fatigue in your legs is okay. Chest pain, dizziness, palpitations, that's not okay, right? There's a normal response to exercise, and then there's abnormal. Normal is the breathing and the leg fatigue. Abnormal is anything else. Normal's good, abnormal's bad. All right, a little sip of water. Feel free to join me if you'd like. All right, so let's do our resistance training exercises. I think on Thursday we did our squats. So Tuesday is going to be step lunge day for our legs. Everybody knows I like to work our legs. So for this one, hold on to something for a little bit of balance. You're going to put one leg out in front of you, one leg behind, standing up nice and straight and tall and looking forward. And then you're just going to lower your leg to the ground. It'll look like this. Making sure to breathe. And let's do 10 repetitions. So that's 3. That's 4. 5. 6. 7. 8. 9. And 10. And now let's switch to the other leg. And for this one, I'm going to do it as if I had a chair. I don't think I've shown you guys this way, but try a little variety. So once again, leg forwards, and then all we're going to do is we're just going to lower to the ground. 1. I'm just holding on to these for balance. I'm not pushing, just for some balance. 3, 4, 5, 6, 7, 8, 9, 10. So there are 10 lunges. And then I think for our upper body today, let's work the muscles in our back. We'll do our semi-upright rows. Got my gym bag, it's loaded full of books. I'm going to get a chair, and I'm just going to rest my hand on the chair. My legs are going to be nice base of support, good and strong. Grab something that's got a little bit of weight to it. And then I'm just going to pull it up to my armpit. We'll do this 10 times. Four, 5, making sure to breathe. 6, 8, 9, and 10. And now let's switch. We'll do the other side. It's a good base of support. 1, 3, 4, 5, 6, 7, 8, 9, and 10. Whew. All right. And now we'll finish off with our stretching routine. So we'll stretch our triceps first, arm out in front of you, and then pull it across your body, and then just pull your arm into your chest with your other arm. Don't forget to breathe. And I like to always keep moving. Keeps me from getting lightheaded or dizzy. Okay, shake that off. And now we'll do the other arm out in front of you. Pull it across your body and pull it into your chest with your other arm. The weight training follows the same thinking as the aerobic training that we do, by the way. You do want to make sure that you're working hard, right? Not too hard, but hard enough. Okay, and then just shake your arm off a little bit. Next one we're going to do is for the chest. So if you can loop your fingers behind you, great. If not, just come close. And then you're going to pull your shoulders back and just look up to the roof a little bit. We'll stretch out our chest. So with the resistance training, if you feel that doing 10 repetitions gotten pretty easy, try building to 12. If 12 is easy, to 14, then finally up to 15. And this next part is important. Okay, let's just shake that off and we'll stretch our calves. So our runner stretch up against the counter. Both feet flat on the ground, both feet pointing straight forward, making sure to breathe. So with the resistance training, once you get to 15 repetitions, when that gets easy, don't do more repetitions. What I'd like you to do is actually lift a heavier weight. So if you can do 15 comfortably, grab something a little bit heavier, but then drop back down to 10 repetitions. Let's switch legs. So once you can do 15 repetitions with something that's, a reasonable weight, Drop down to 10 repetitions, but get something a little heavier. And when you go from that 10 repetitions and build to 15 and then back down to 10, that gives you a really nice combination of increasing your strength and improving your endurance. And that's the best way to improve strength training. You don't want to focus on just one or the other. All right, let's finish off with stretching our hamstrings, and then we'll be done for today. Grabbing a chair and then just sitting, not up against the back, a little bit closer to the edge. One leg is going to be bent, the other leg is straight out in front of you, and then reach as far forward as you comfortably can. You'll feel the pull through the back of the straight leg, your hamstring muscle. Don't forget to breathe. All right, and then let's switch over to the other leg. Remembering to breathe. And if you want to make this a little bit harder, you can always just pull your toe up, pointed towards the ceiling, and that will give you a little bit more of a pull in your hamstring. Whew. All right. You can shake that off a little bit. Folks, we are done. Good workouts. Let me just come over here and see if there's any questions I can deal with really quick. Okay, so let me see. I know there's one comment from one person, disappointing that we won't be running this through July. Yeah, it's COVID times have been very, very difficult for everybody. I think I've mentioned in the past that about 40% of our staff have been redeployed. So we're trying to work with as many people as we possibly can with much smaller numbers. But do keep in mind that the sessions we have recorded, they're going to be online, and you can watch them as many times as you want, and they're going to be kept online indefinitely. So, you know, whether it's a month from now or a year from now, you will be able to follow along with those. And I know I was chatting with Crystal as well to see if maybe there was some way I could make more of a generic video where I'm not talking about any specific topic. I'm just talking about the actions that we're doing. Maybe add one or two more resistance training exercises, put the whole thing to music, and then people could just follow along with that one as it's re-recorded. Let's just check the Q&A real quick. Is biking better than speed walking? For example, I can do a 40-minute speed walk or a 15 or 20-minute bike ride. One of my colleagues just sent me an article about that earlier this morning. You know, bless your heart, it's a wonderful organ. It's really great, does a lot of work, but it's not very smart. All your heart knows is muscles are moving, I got to send blood. So in terms of cardiovascular benefits, specifically focusing on your heart doesn't know if you're biking or if it's walking. As far as your heart's concerned, legs move, send blood. So from a heart point of view, they're going to be pretty much the same. As long as you get your heart rate doing the same amount of work, and it does that work for the same amount of time, you're going to get the same benefit. So if your pulse is 10 at rest and it's 20 when you bike, or if it's 10 at rest and it's 20 when you walk, if you go for 30 minutes, you're going to get the same cardiac benefits. So much of other things to consider. If you've got really bad knees and you can't walk very well, maybe biking is going to be better for you. Likewise, if you don't have really good balance and you're at a falls risk for using a bike, then maybe walking is the way to go. So kind of hard to say one is better than the other. It really depends. And what was the second question? Can you explain a bit more about metabolic strength or metabolic conditioning or training, I think is more the word that I used. I like to envision the concept of metabolic conditioning versus cardiovascular conditioning. So metabolic conditioning is improving your blood pressure, your blood sugar, body composition, things like that. That can be achieved with a fairly low intensity effort. You just have to put a lot of time in. So when you get these people that have got, let's say, a factory job, and they walk for 8 hours a day, and they say, Rob, I exercise at my job for 8 hours, that's enough. That's very, very good metabolic conditioning. It burns calories, it's good for cholesterol, sugar, blood pressure, all those metabolic things that I just mentioned. And that's really, really important. So it's a good thing to do. But if you're walking at the office for 8 hours and your heart rate never really goes up, you're not putting any stress on your heart and your lungs. So the fitness of your heart and your lungs has got no reason to increase. So you're not going to get that cardiorespiratory conditioning, the cardiorespiratory fitness. And that's why I like to tease the two apart. They're both very, very important, but what improves your metabolism is not going to always improve your fitness. That's why I say you really want to try and target both by making sure you lead an active lifestyle. A heart-healthy lifestyle is an active lifestyle, and that's definitely going to help with your metabolic fitness and all those things. But you also want to make sure that you spend ideally 150 minutes per week at an effort or an intensity that increases your breathing, makes you sweat maybe a little bit, because that's going to load up your heart and lungs, and that's going to improve the strength or the conditioning of your heart and lungs, which a walking program where you're just walking nice and slow and casual might not do. So hopefully that clarifies metabolic conditioning versus cardiovascular conditioning a little bit. Simplifies it. It can be quite complicated. Jennifer, thanks. This is, yes, true, and thank you. FYI, live is very motivational, but I will work to be more committed. You know, that, and I mean, that's really important. I've been talking to a few people, and I've got some patients that are going to be graduating off the program shortly, and they're all saying the same thing. They're just going to miss the interaction with me. I'm so motivating. I'm so positive. I get people going. Everybody can do everything, and I get that. But at home, you guys need to realize that you're not doing this for me. You know, if you don't do it, or if you don't do it, this is going to sound cold. I'm going to get paid anyway. Right? You shouldn't be doing this because I'm asking you to do this. You should be doing this at home because it makes you feel better. It improves your health, improves your quality of life, keeps you out of the hospital, makes you live longer. And there's a whole ton of other reasons that we should be doing exercising. And nothing on that list should have the thing because Rob wants me to. Right? You guys need to be doing it for yourself. So I know it's great to work with someone, and it does help motivate. But if I'm not here next week, hopefully you guys at home are still getting your exercise in. All right, folks, I've talked for a long time. I think I've answered all the questions on here. Jennifer, hopefully weather up in Barrie is as gorgeous as we're having here. Folks, have a fantastic Canada Day tomorrow. I will be back on Thursday for a live session, so I will see you guys then. All right, folks. Thank you very much. I'm going to leave this up if anybody has any more questions. Otherwise, we'll see you in a couple of days. All the best.